folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Oh, quite impressive, Brad. Today we're going to talk about how to treat tendonitis of the knee.
Oh.
Now, when I use the word tendonitis in the title, in many cases you might have a tendinopathy. And first off, let's talk about where the tendons are at.
Sure.
On the knee, the main ones we're talking about is the patellar tendon that attaches the kneecap to the tibia. That's this one right here. Brad, do you agree?
Yeah. So on a real person, there's my patella or kneecap. There is my tibial tuberosity.
Tuberosity, yeah.
Yep. And right there is that tendon that experiences a lot of stress. I mean,
Right.
it's made for it, but sometimes it
jumper's
gets
knee,
irritated.
they call it.
Yep.
The other one is quadriceps tendonitis, where you can actually, the quadricep attaches to the kneecap. This white stuff right in here, that can get flared up and cause a tendonitis too.
Yeah. So it's right above the kneecap. You feel it there. There's a little hollow spot there, and that's where it is.
Now, in some cases, these tendons have somewhat wore out. They're not inflamed; they're wore out,
Ooh.
and that's tendinopathy.
Okay.
But in both cases, they're treated the same way. So we're going to do the same thing.
And they both produce pain with stresses, and so
Yeah.
the name is not
Jumping,
that particularly
right.
important for this treatment.
So we talked about the two common types. Let's jump right into Brad. How do we first tell whether or not we have it or not?
Sure.
The best way to tell is just to feel on those areas and rub across them and see if they're tender.
Yeah. So we call that palpate
Yeah, palpation.
in the therapy medical world.
Right.
So I'm going to go. Here's that.
Here's the kneecap.
Yep.
And right below is that bump, and
Yep.
right in between.
So I'm gonna push down a little bit and run back and forth, and you might find it's more tender where it's connected to the bone, that bony prominence.
And then it might be Osgood-Schlatter disease,
Mm-hmm.
especially if you're younger, if you're like in the growing stage of your
Right.
life.
Yeah. You
Very
got a
common.
bump there associated with it. So you can check that out. If that's pain-free, you may go above the kneecap. I like to use my thumbs there because I can get in there and really feel things
It's
better.
not hard to diagnose this, Brad. I
Sure.
had quadriceps tendonitis, and it
Yeah.
hurts right there. You can push on it; it hurts right there.
Yep.
It's a little harder to treat though. So, but let's go into that, Brad.
Sure.
So the first one, let's talk about treating the quadriceps tendonitis, the one above the knee.
Sure.
So we're going to do for both of these is cross fiber friction massage. So,
That's a mouthful, Bob.
yeah, what we're trying to do is get more circulation to the area. And in addition, we're trying to, if there's some scar tissue, we want to break up the scar tissue a bit too.
And if you're wondering, when we say scar tissue, it's like, well, I never had an injury or a laceration. It may be just because it's inflamed, it's healing.
Right.
And part of that process of healing is forming scar tissue to make it stronger. The scar tissue lays down in an irregular fashion, which can make it painful. We want to break that scar tissue up and work with it so that it's strong.
So if you start rubbing over the area and you rub for 30 seconds or a minute, and the pain just keeps getting worse.
Yeah.
Oh.
30 seconds, it still
Yeah.
hurts. It's getting worse. What do I do, Bob?
In that case, you'd back off, probably ice for a while, and
Yeah.
then try it again in a couple days.
Yep.
Now, the same is going to be true for the patellar tendon. You're going to rub across it. Now, quite often we'll take finger over finger
Yep.
or finger side by side. Here, Brad was actually using his thumbs.
Well, and that
worked out good.
may differ from person to person. I just feel more comfortable and more aggressive this way, and I could do it this way too.
Now, a lot of this was invented by James Syriacs, the father of orthopedic medicine, and he would recommend doing this, Brad, for 15 minutes, 3 times a week.
Yeah. Assuming it feels better or that numbish feeling and you continue to work it, but
Right.
then you're going to get tendonitis in your fingers,
That's
your
right.
thumbs.
The way it worked for me is I had to use a massage gun. It's just so much easier. I was doing all these other things, icing. I was doing eccentric strengthening to the muscle. None of that seemed to help. When I started doing massage to the upper tendon there, yep,
Upper
right up in
kneecap.
here, that it got better, 80% better within a couple days. you can get right in there. You can actually push up on the kneecap if you want.
Sure.
By pushing up on the kneecap, that kind of exposes the tendon.
Yep.
And you could go across the tendon like this. And I actually even would bump up against the bone a little bit.
Okay. But, do be careful.
Yeah.
Because especially he's got a more aggressive head on it.
Right.
These heads pop on and off. This round one's not, is a little softer, and it just has more surface area, so it's not as aggressive. Start with the less aggressive one before you go to the more pointed.
Brad, you want to show
plastic
the
one.
less aggressive way?
Yep. And these massage guns, they don't just vibrate; they percuss. They go. They travel.
Hammer.
Yep. They travel this way. So that's nice because if you go like this, that's pretty aggressive.
Straight on.
If you go this way, much less aggressive. Plus, you get that cross fiber
it's going
motion.
across that way.
Yep. And you may want to start above, working to the muscle. And if you do have tight muscles, actually working the muscle is not a bad idea. And then work down to where the actual inflammation and tendonitis is.
Yeah, either way, you're going to want to work the muscle too.
Yep.
Because you really can't down here.
Yeah, there's no muscle there. We just got the bone,
to bone.
the patella and the bone.
You want to show on the patellar tendon?
Yep. And now on this one, you're certainly not going to go directly.
Right.
I mean, we're going to go.
It just really bounces, and it's very aggressive.
But it does work nice, especially I'm a big fan of those the round head in
about
general.
The right size
fits
for that.
right in there. And now I may straighten my knee, get my quads relaxed, and if I push on the
You
kneecap,
can push down the kneecap, and I'll bring it up and kind of expose the tendon a little bit.
Get that tendon on slack so you can really work that massage. Whoa, right there it hurts. So I'm going to stay away from that. I've got a healthy. I was hitting something other than my tendon.
Oh, you were hitting the bone probably.
Yeah, respect your feedback from your body, and you should not be creating that sharp pain. That wasn't real sharp, but it was.
By the way, if
enough.
you do get diagnosed or assessed with SCHLATTE'S disease, we do have a video on that on how to help it. By the way, this video is a part of a series of videos on knee pain. If you want to check out the entire series, go to bobandbrad.com, go to the program section, and look, we have different titles, different subject matters like sciatica and hip pain, and find the one on knee pain, and you'll look in there, and we have a list of maybe 40 videos.
Yeah.
Check them out.
You don't have to look at every one. Just look at the title. View the ones that pertain specifically to your concern. The beauty of it all, it's all free. We don't even ask for email. There's a PDF printout for every video. They're about 10 minutes long. You can print it out and have the exercises and a review of the whole video right there in hand. So
including this one.
That's right. Are we done?
We're done.
Excellent. So good luck with that tendonitis of your knee. Get the pain going much better and feel better, and be careful.
Adios.